Observational studies looking at countries such as Ghana, Sierra Leone, and other Western African countries show that in places where there are high circumcision rates, there are low rates of HIV. And in countries such as Swaziland, where circumcision rates are low, there are high rates of HIV. By the time Swazi men are in their 30s, nearly half of them have the HIV virus. Male circumcision has the potential to turn the tide of the HIV epidemic by reducing their risk of acquiring the disease by up to 60%. This is the story of Mlungisi and his journey to get circumcised.
I'm one person who likes being a role model to the society. If ever there is something good that's supposed to be done by young people, I want to be the first one to do that. Sometime back, I was in hospital, then they were talking about this thing in newspapers. They talk about how important this male circumcision is to us young people, because it usually helps us maybe prevent these HIV things and other sexual transmitted diseases.
Kwangijabulisa mina ngoba asebesachazile ngalobu mculo sembuka nangale ndlela abantu labafa ngayo nasachaza ngabona ukuthi cha umculo.
Okay, ngiyajabulela because ingcuphe yabantu bayagula vele banema STI, so ngijabulela ukuthi on the safe side.
Ngicala nje ngathi ukuthi kwi-culture lesinye isizwe esinomsathi ngingasi-rife kangako so uyabona besangidayela yabona njenganyana lesikhathi esiphila kiso yabona siphila esikhathini esimadingi se-HIV nabo-different indlela thatha kuse yaphile sesabo
first 2 weeks after operation
ngazayiindlela bahamba ngayo akuyilaphilile camla sitomdanzela mhlawumbe.
People may expect me to be a bit nervous, but that thing is, it depends on that particular person. If ever you really wanted this thing, actually you become the opposite of nervous. Actually, you become more excited, since you can't wait the moment when the operation is done and you feel like you're just a new man. I can't wait for that.
Welcome to Litembalet Women's Clinic.
Male circumcision has been shown to reduce the chances of a man getting HIV. So if you do circumcision, you're actually effectively removing this skin and actually taking it out. Circumcision on its own is not actually the final answer. It should be part of a comprehensive sort of strategy to reduce HIV infection. Before the procedure, they actually get counseling and they are told about the procedure and they are told what it means.
My counselor, they was so good in a way that he was able to strengthen me up. Even makes me understand some of the things I had a lot of queries and questions about. Now I know exactly what's gonna happen.
Mlungisi, how are you? I'm fine. I'm in Istanbul. I'm working in the theatre.
Nice to meet you.
So I've come to circumcise. Everything seems to be in place. Are you ready to come in?
More than ready.
Okay.
Cheers, man. Thank you. Yes,
my name is Sympathy Mpofu. I'm a male circumcision clinical nurse here at the PSI clinic in Matapa. So what happens inside behind the curtains in the theatre room, when the patient comes in, the local anesthesia is given, which is going to assist him in reducing the pain during the surgical procedure. The procedure starts with the doctor cutting, removing the foreskin. And afterwards, we're going to dress the patient with maybe Vaseline gauze, and the patient is going to be escorted to the recovery room to recover for 30 minutes.
Well, I think
feel very much relaxed. I mean, I feel good and I'm proud of myself. I was expecting something better than this. Actually, I was perplexed to see that this is just a normal process, and it's usually there isn't that much pain, or the only pain you get is through injection. After that, you just feel no pain. I can urge each and every Swazi guy, a circumcision is a must do. It's a must do. I feel like I'm fully healed. No complaints. Funny part is that all those friends of mine who were playing pool the other side, they couldn't. Actually, they didn't want to reveal their true feelings, that they didn't want to go there. The moment I came back from the whole process, they couldnn't believe actually that I've already done the thing until I showed them the bandage. Because what they were expecting exactly was there. I would walk so scary in a way that I wouldn't be active, that I wouldn't be spending all my days sleeping. I was able to convince them in a way that they wanted to go to their clinic the very same day after myself. Guys, I should tell them they should go for circumcision. And one thing for sure, they shouldn't take any chances. Being circumcised really doesn't mean that you cannot get AIDS when you have unprotected sex. You just become 60% safer from contracting this HIV thing.
Kulile, 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 kulile.